Overshadowed by political noise and a media more interested in spectacle, Joe Biden quietly delivered one of the most significant healthcare reforms in decades. While coverage obsessed over polls and partisanship, his administration silently focused on programs and policies that directly improved the lives of millions. Starting his presidency in the middle of the pandemic, preventing COVID-19 was about protecting American lives, long-term health effects, and restarting the economy. After the FDA approved the vaccine, Biden's administration launched a massive distribution campaign vaccinating over 200 million people in just 100 days. The scale of this effort was unprecedented and crucial in getting the country back on track to avoid a recession. One of his key pieces of legislation is the Inflation Reduction Act, leading to a slew of healthcare improvements, the first of which is allowing Medicare, which is health insurance for people 65 years and older or individuals with disabilities, to negotiate drug prices. If you think a large company has sway over negotiating their drug prices, imagine how much power Medicare has with its 60 million enrolled Americans. It is the single largest healthcare service provider. However, since 2003, and thanks to the Medicare Prescription Drug Improvement and Modernization Act, implemented by George W. Bush, Medicare has been unable to negotiate its own drug prices. For 20 years, the healthcare industry used lobbying to take advantage of taxpayer funds, and Biden changed this, with the new rule stating Medicare can negotiate drug prices after they've been on the market for 7 years following FDA approval. He was fighting for taxpayer money, curbing real waste and fraud, saving an estimated $100 billion over 10 years. The Department of Government Efficiency, or DOGE, named after a meme coin and run by 19 to 25-year-olds, could take notes, with only $63 billion in verifiable savings, and importantly, Biden did this with no adverse effects to existing programs. Continuing to fight, Biden implemented another provision to save taxpayers money and prevent predatory behavior by ensuring drug manufacturers pay a rebate to Medicare if their drug prices increase faster than inflation. This stops your drugs from increasing year after year after year due to nothing more than a company wanting to profit off of your health. The law also capped out-of-pocket healthcare costs at $2,000 for Medicare Part D, benefiting 50 million Americans, and preventing medical emergencies in America's uniquely expensive healthcare system from pushing people into bankruptcy over unpredictable events they can't control. Oh, and insulin, the necessary life-saving drug 8 million people need to take daily that only cost a few dollars to manufacture, was capped at $35 per month for everyone on Medicare, directly benefiting 1.5 million Americans. Democrats have fought for this for years. Biden was the one who delivered. Now, if you're wondering, why do we have to wait 7 years before negotiating drug prices, or why insulin isn't capped at $35 per month for everyone? Biden could have done better. Realized that he wanted to implement both, but the bill only passed by Kamala's tie-breaking vote, and to get this to pass, they needed to appease moderate Democrats. Biden also understood that healthcare is all-encompassing, rapidly improving mental health laws to keep up with today's age. He started with improving the Mental Health Parity and Addiction Equity Act, which requires health insurance providers to treat addiction and mental health on par with how they treat physical health. This was a 2008 Obama law that health insurance companies were able to skirt with weak federal reporting and enforcements. Biden improved this by clarifying existing provisions, collecting data, and prohibiting methods to make it harder to access mental health and substance abuse. For example, blocking the requirements for authorization and copays for mental health and substance abuse if the requirement does not exist for the medical conditions. An often missed trait of Biden's presidency is how he knew how to use enforcements to get companies to follow the law, similar to how Biden enlisted the IRS to prioritize enforcing nonprofit hospitals that weren't providing free and reduced pricing care to patients who legally needed it. Furthermore, he invested in mental health for kids, training and hiring 16,000 mental health professionals for K-12 schools with the Bipartisan Safer Communities Act. This gives kids treatment early, improving the trajectory of misguided individuals, and pays for itself by reducing the socioeconomic impact that troubled individuals can have on society. If we can send soldiers to war, we can provide them with treatment when they get home. To help with veterans who commonly suffer from PTSD, Biden granted MDMA-assisted therapy as a breakthrough therapy. This designation helps fast-track the review process, and it's the first time a psychedelic-assisted therapy has reached the FDA approval application stage. He also updated suicide care for veterans, changing the VA guidelines to provide 30 days of inpatient acute suicide crisis care and 90 days of outpatient care for VA and non-VA facilities, plus emergency transport and prescriptions. Finally, with the PACT Act, he provided free toxic screenings and treatment for veterans to help detect illness after exposure to burn pits, Agent Orange, or other hazardous substance. It extends the health coverage in the VA to eligible veterans from the Vietnam, Gulf, Iraq, and Afghanistan. So far, this has already gotten over 5 million veterans screened. Targeting addiction, Biden signed the bipartisan PACT Act, which eliminated outdated restrictions on prescribing treatments for opioid use disorder. This single change allowed an estimated 1.8 million more healthcare providers across the country to prescribe it, opening the doors for dramatically expanded access to treatment, especially in rural and underserved areas. Biden also pushed for life-saving addiction treatment, with a $450 million investment in overdose, surveillance, medication for opioid use disorder, recovery centers, anti-fentanyl campaigns, and bolstering efforts to shut down illicit drug supply chains, along with possibly the most important change, making Narcan available over the counter. This treatment, Narcan, can reverse an overdose and literally bring someone back to life. That's why Biden's strategy included making Narcan widely available, not just in clinics and hospitals, but similar to AEDs, having them in public safety settings like schools, libraries, and transit hubs. He wanted to put this medicine into the hands of bystanders and first responders to stop overdoses before they became fatalities. And it was incredibly effective. Using these opioid grants, states purchased nearly 10 million Narcan kits and have reversed over 600,000 overdoses. Along with the improved access to the opioid addiction treatment, his work led to a widespread improvement. In 2024, U.S. overdose deaths fell 27%, adding to Biden's list of breaking multi-decade records for the largest single-year drop in overdoses in 45 years. The previous record being only 4% in 2028, and it is pitiful how few articles there are about such a key and vital issue in today's society. As he did with Narcan, Biden pushed to make other treatments over the counter. This included COVID tests, PrEP for HIV, Opill for birth control, and hearing aids. This not only makes them more accessible, which is important for things like birth control, but less expensive, with the price of hearing aids dropping from over $4,000 to a few hundred per pair. Another minor but impactful change is that the Affordable Care Act requires that insurance providers provide preventative screening at no cost. And Biden lowered the recommended age for screening to align it better with prevention, providing free and improved breast, colorectal, lung, and cervical cancer screening, leading to an additional 8 million screenings, and importantly, 400,000 have had abnormal results, with an estimated 200,000 lives saved. Or, unheard of but important, is his organ transplant reform, where United Network for Organ Sharing has been the only private nonprofit organization working with the federal government in 40 years. The U.S. Organ Procurement and Transplant Network Act ends this exclusive contract, allowing multiple contract awards for different functions, leading to more efficiency through competition, along with establishing a mandate for auditing these vendors. Using the Safe Drinking Water Act, Biden updated the first ever nationally legally enforceable drinking water standards to target the forever chemicals that are linked to cancer, and is so bad and widespread the movie Dark Water was made about it. The updated standard target PFAS along with 4 other Gen X chemicals and are leading to the reduced exposure for approximately 100 million Americans, or 30% of the U.S. population. Biden provided the investment to make the changes to meet these standards in the bipartisan infrastructure law, investing $21 billion in water system upgrades, with $9 billion especially for PFAS and other contaminants. Even though the media decided this wasn't newsworthy, this is a huge accomplishment, and I hope you're getting my point of things being left unsaid. It is also notable that he protected millions of acres of federal land and water from drilling, invested in cleaning up landfills, mines, oils, and other abandoned toxic sites, or his implementation of the waste emission charge, which charges for methane emission to curb pollution. Importantly, this requires advanced monitoring technologies such as satellite, aerial surveillance, and continuous emission monitoring systems, after it was found that major oil and gas company emissions were actually 3 to 4 times higher than initially disclosed. Although drinking water, mines, landfill, methane emissions are environmental, they also impact our health, with 7 million premature deaths each year due to air pollution or the PFAS in our bloodstream, which have led to higher rates of cancer and have caused reproductive or immune system harm. All of this was part of Biden's cancer moonshot efforts to reduce cancer in America's population. Doge made all the noise and headlines, but Biden quietly outpaced those savings by negotiating drug prices. Insulin prices have been an outrage for years, and Biden capped it at $35 a month for Medicare. Flint, Michigan was a national scandal. Then Biden updated drinking water standards and invested billions to replace lead pipes. Overdoses dominated the news cycle, and Biden made Narcan available over the counter and stockpiled it in public places. So I'm left asking, where are the headlines? And where's the coverage? It's pitiful how much he's delivered with so little recognition, not only from the media, but also from the Democratic campaign itself. The largest drop in overdose deaths would be a lot better if it wasn't left unsaid. Next in the series, what Biden did on debt. From making it possible to discharge student loans in bankruptcy to preventing harassment on medical debt you don't even know.